Good evening, and thank you so much for tuning in from wherever you are tuning in for the Medi Health Show. This is GTN TV, the home of gifts and talents, and my name is Mumbi Mavuti. I bring to you this health show where we focus on your wellness, and today we're going to be talking about asthma, a disease or a condition that affects your airways. And we have Dr. John Maore with us here in studio. He's going to be educating us more about that. Karibu sana. Thank you so much for making time for us.
Thank you so much. My name is Dr. Maore John from Mudhaya Level 5. Karibuni sana. Remember that your health is your richness. So as we talk on this disease that affects the upper respiratory tract or respiratory tract disease rather. Yeah.
Yes, thank you so much. And let's just start right from there. What is asthma and who is at risk?
Well, asthma has a broad term. It's a chronic inflammatory disease of the airway that develops under an influence of something called allergens, which we'll talk about different types of the allergens. I think we will discuss them. And it causes a hypersensitivity reaction of the airway. And what you see or what you hear, for those who have experienced that, presents with chest tightness, wheezing, sometimes cough, and also difficulty in breathing. And also remember that it is a reversible condition also. Yes.
So one can be totally cured. And who is at risk, or is it a disease? Is it a disease or a condition?
Well, it's a disease of the airway. Before maybe I talk about who is at risk, let me bring to the viewer to an upspeed of the epidemiology of this disease. You realize that statistics say that the disease affects around 300 million in the whole world. That means around 1 to 18% of the population. And out of that population, who are affected, 250,000 die each year of this disease. And out of those who die from this disease, 80% come from low and middle income countries. And it affects more boys than girls. And also you realize that it affects more boys than girls. And also it is more common also in those countries which are developing. I think it's because of maybe the industrial revolution or something there. Yeah. So who is at risk? So we say the person who is at risk is those who have something called atopy. And atopy is there are people who have some predisposition to allergens, where you develop a hypersensitivity reaction that triggers an immune response in your body, which we say you have a production of some antibodies which are overreacting, like we call them immunoglobulin E antibodies. On that connection, it has some genetic influence. And they say that those who have, who are less predisposed to certain diseases, for example, a disease like measles. Also, those who are less disposed to rural environment. We have so the rural environment is actually protective to these diseases, in that you have siblings who you are brought up to, and then also those who go to daycare as early as possible. You develop an immunity that is able to respond to this condition, and also less use of antibiotics. The opposite of this is true, in that those who have not been exposed to these categories of example of a condition that I've said or the experience that I've said, they have a predisposition to develop an unanswerable immune response, which is triggered by some helper cells. In your body, in our system, we have some helper cells, which influence an imbalance, if not controlled well, imbalance of the body, which triggers a response of the body, as I said earlier, resulting in the production of an IgE. These IgE immunoglobulins are the ones that actually interact with environmental triggers, like those allergens that I mentioned, to produce a hyperreactive response, which you see with people with chest tightness. We see them coughing, some have difficulty in breathing, and some have even runny nose. Yes. So it is both a genetic with an environmental interaction for you to bring to come up with an asthma. Yes.
Thank you so much. And also, while I was researching about asthma, I also realized that we have different types of asthma. If you could maybe just highlight to us what could these types be and what is the difference between them? Yes.
As I said, asthma is different, and the key one, actually 80% of asthma is caused by allergens. And so we have allergic and non-allergic type, whereby the allergens, some types of the allergens that a few of them that I can mention is one, we have dust, we have pollens, we have smoke. Those are some of the types of allergens that can cause trigger an immune response, which is hyper. So the difference actually between an allergic person or asthmatic person and non-asthmatic person is that the way our body answers to this exposure of the environment is so different. And I remember I said that, to bring also back again, remember I said that the way our bodies answers to these triggers or the outside environment is different based on how our genetic is. And I say that if your genetic is more lying towards some type of cytokine imbalance, that is Th2, you have a trigger in that your response will be more higher, and that's why you reproduce those symptoms. That type of asthma is occupational asthma. You realize that there are some who cannot even use a latex gloves, because once they wear them, they react to them. Others cannot even work, for example, in a bakery where there is maybe a dust, maybe resulting from maybe a flour, the mill's dust. Another type of asthma is exercise-induced asthma. So we realize that if they say that if you exercise and you develop some symptoms, which are heavy response symptoms, for example, chest tightness, you start coughing, you start having a wheeze, so then you have an exercise-induced type of asthma. The others that we call like seasonal asthma, realize we are heading to cold seasons, and if maybe you develop your asthma, you develop these symptoms, the worsening of these symptoms during the cold season, then it means you have what? You have a seasonal asthma. Some maybe seasons like hay fever seasons, they develop what? This hyper response of their bodies.
Yes, thank you so much for that. And given that we could have these different types of asthma, does the severity of either of those differ? Do we have one that could be more severe than the other, which brings me to the categories of asthma?
Yes. You realize that asthma, we can categorize asthma into different categories, we base this depending on our assessment, which is called the spirometry, whereby this is like we have something called FEV1, which is forced expiratory volume that you exhale. It's the amount of air that you exhale in a minute. We also gauge your symptoms depending on your clinical assessment when you come to the hospital, how you we assess you and we see what category you are in. The categories we have in terms of we have the intermittent, we have the mild, moderate, and the severe categories. With the intermittent category is whereby you have these symptoms. Remember, we said the symptoms are the chest symptoms. Mostly you have the cough, wheezing, chest tightness, and also difficulty in breathing. So you experience these symptoms in a week. You experience maybe one of these symptoms in a month. Sorry, you experience this one or twice in a month. And we also have those other symptoms like nocturnal symptoms. These are night symptoms. Some experience these night symptoms. For example, they experience the symptoms of the cough, wheezing, or chest tightness. So gauging on the amount of the symptoms, how much you experience maybe in a week or a month, then can be able to categorize you into a mild, a moderate, or a severe picture of it. And then we also categorize it depending on the types of the flare-ups. Flare-ups is whereby you have this excessive of the presentation, depending on the number of times that you have. Some can affect your activities of doing. So, for example, you cannot do anything. Once you get these symptoms, it means you have a severe category of what? Of asthma. Yeah.
Thank you so much. And you're mentioning some of these signs and symptoms, and we are going to be discussing that deeper. But is it possible that one could confuse asthma for flu, Homa?
Yeah, yes, you can confuse them. But remember that we said asthma has a response which is hyper response. So if your body answers to the nature in a way that is more hyper responsive, then you might be having what you might consider it as an attack or an asthma thing. And also remember that not all symptoms presents the same. You can have a flu that can present in a way that that has some aspect of asthma in it. And actually asthma predisposes you to even getting there is other respiratory disease easily. So sometimes you can have a combination of a flu in connection with asthma. Yes. But asthma has a trigger, as we said. Yes.
So now let's talk about the signs and symptoms. Of course, you've mentioned coughing, wheezing. Could there be any other sign? Could there be any other symptom?
Yes. Let me talk of cough. Cough, sometimes some people even develop this cough actually at night. And what causes them to get the cough at night? You realize that there are some, for example, there's sleeping position. Those who are asthmatic, sometimes you can sleep in a position that can constrict your lung. Inafanya, you press your lung, and this pressing of your airway triggers an immune response. Others, like for example, others sleep actually while facing up with their back, and this one can cause maybe a mucus flow from your nostril and go to the throat. This one can cause a trigger of a response of the body. Also, some other people also are exposed to allergens at night. Where we sleep, our rooms sometimes have moles, or even our bed sheet that we use. So you can be having these constant symptoms at night, and you wonder what could be. So you check on maybe our beddings. You check also on our rooms, how ventilated they are. Others also develop these symptoms at night as a result of hormonal imbalance. Sometimes there is a reduction of some hormone like cortisol, which can trigger a response, a body response to what? To this asthma. And so the baseline of these symptoms, mostly the cough, the chest tightness, the wheeze, and the difficulty breathing, I can actually explain them into three mechanisms that brings about this one. One is airway inflammation. I mentioned about these immune cells or imbalance of cytokines. We have some cascade of immune response that the body actually activates once you have these triggers. So with this airway inflammation, it causes an airway obstruction. So the airway obstruction, whereby you have your vasoconstriction of the bronchi, you have your edema growing and also remodeling of your respiratory system, which also leads to something called bronchial hyperresponsiveness. All these combination of this triad of pathogenesis explains why most people get these symptoms that we usually see them having. Yeah.
And sometimes, is it possible, okay, like, is there a difference between having asthma, like I have asthma, and an asthma attack, the one that will lead someone to having to use the inhaler, and what triggers that, the asthma attack now?
Yes, so one, if you're not well controlled, your asthma is not well controlled. For example, because of poor control of the asthma, it can dispose you to get those more severe of the attacks. Also, if you're exposed to allergens, it's good that we identify what kind of allergens or what kind of triggers, because it has some environmental influence. Remember, you said it's a genetic and what? And an environmental influence. So you need to know what kind of environmental influence does what triggers you to develop these an acute attack. Remember also I talked about our genetic makeup. Our genetic makeup is different. The way someone answers to a response is different. So it's an individualized kind of a response. Yeah.
Thank you so much for that. And how is it diagnosed at the hospital?
Thank you. Basically, asthma is more of a clinical assessment, although there's an advantage, or there is an input when we use the diagnosis in terms of our lab works and imaging. So these ones helps us to tell us how good control is, and also the exacerbation of the symptoms, how worse the symptoms are going. Also, they also help us to rule out if there is also other diseases. Remember, I said that there are some other conditions that you can mimic, like for example, a wheeze. I say that some people develop wheeze and they don't have asthma. So wheeze can be a baseline of other conditions. You can have pneumonia and have a wheeze. You can have a heart condition and have what? And have a wheeze. So there is a role of laboratory lab key, and also the imaging aspect. So for the lab, the mostly that helps us to really tell about this condition is what we call the some blood gases. You analyze our gases in our arterial system, and also use what we call spirometry. Spirometry helps us to tell us how good and how good your response to the treatment is, or how symptoms have really exacerbated. With your imaging, for example, your chest X-ray, it will help us to tell us if there is a complication that develops due to poor control of the asthma, or there is another underlying condition that maybe you can can mimic an asthma attack. If you have a chronic response, or a chronic disease that is not going despite being treated, so we recommend also you do a CT chest scan, which can help us to guide us if there is a complication, or there is a poor control that we can get from the imaging.
Yes, thank you so much for that. And you mentioned that it is reversible. How can that be done?
Thank you very much. The reason why I said it's a reversible is because we can reverse the triad of these causes. Remember, I talked about the airway inflammation, I talked about airway obstruction, and also airway bronchial hyperresponsiveness. How we can reverse this is we use some medication. First of all, we need to really know what triggers the asthma. So the first thing is to avoid what the trigger is, and the second thing is with some medication, depending on the presentation of it, that can be used to reverse this hyperresponsiveness, or this answer that the body answers towards the asthma. So we use inhalers depending on how severity or how presentation you present. We use some of the inhalers that counterchecks or counteracts how the body responds. Yes.
And that is now the management part of it, and through that management or treatment, one can get cured and another would have to do with the inhalers and treatment for life?
Actually, the key thing, what we usually target with asthma is we prevent the symptoms. The goal, let me talk about the goal. The goal of treatment is you prevent the symptoms, and then you also treat the acute presentation and the chronic symptoms that this patient usually lives with. The first line of the treatment of prevention is identifying the trigger. As I said, you identify what trigger you to have asthma. If it's cold, avoid cold. If it's pollen or dust, you need to avoid what triggers you. The second thing is this one helps first to even to prevent your symptoms, for you to develop what? These symptoms. So we have different classes of medication that we usually administer depending on the severity of the category or the severity of the symptoms. For example, if you have an acute presentation of the symptoms, of course we really have to do our first primary surveillance once you come to the hospital, and then actually we'll taper down or increase your medication depending on how the category or how the severity of the symptom will be. So you can have the short acting, especially when you have acute symptoms. We usually use the short acting medication that actually prevents these symptoms or relieve the symptoms of the acute attack. Those ones we call them the SABA. Then you have the long acting, and sometimes even forced to use even the systemic corticosteroids or steroids. Actually, if your control is not well controlled, there is a way we usually use a ladder to gauge and also to prolong your life, because the goal of us is actually to prevent mortality and also morbidity that comes about with what? With this condition. Yeah.
Yes, thank you so much. And we've been talking about asthma, and we're going to be taking a quick short break, and then when we come back, we're going to be talking about pregnancy and asthma. Don't go away.
Thikũ ici andũ aingĩ nĩ mathĩnio nĩ mĩrimũ ya nerves ta gũturwo nĩ marũngo, ciande, ciara, marũngo makaga hinya, gũikara ũkĩgandaga. Nĩkĩo Neema Health Clinic ĩgĩtongorio nĩ ndagĩtarĩ Mwangi ĩrĩ haha na ithuĩ. Oho nĩ marigitaga mĩrimũ ta kũhingana gĩthũri, ulcers na goita. Mũthenya wa mwambĩrĩrio monekaga Mahich Hotel, Murang'a Town, kũng'ethana na bengi ya KCB. Naguo wa kerĩ makoragwo Thika Rombogo Building hakuhĩ na thitĩnji. Wa gatatũ makoragwo Gĩthũngũri Diplomat House hakuhĩ na thitĩnji. Gũkũ nakuo mũthĩ wa kana makoragwo Maĩ Mahiũ harĩa Mathingira House hakuhĩ na thitĩnji ya Limuru. Wa gatano makoragwo Nairobi Nyamakĩma Moreline House. Na rĩu mũthĩ wa Jumamothi marĩkoragwo Nyĩrĩ Town harĩa Nyĩrĩ Star hakuhĩ na Naivas Supermarket. Nĩ ũndũ wa ũhoro makĩria hũra thimũ namba 0725815641. Ũgima waku wa mwĩrĩ nĩ ũtonga waku. Andĩka maũndũ ta skiza tuni ya thimũ yaku, hihinya *837*3213# na igwatĩre rwĩmbo rũrũ ta rũgambi rwa thimũ yaku.
Welcome to the Nyeri Annual Tourism and Cultural Festival, where we honor our rich culture from traditional music, dances, food, wildlife, and many more. This two-day event shall take place from the 21st to 22nd June 2024 at PCEA Nyamachaki Primary School grounds in Nyeri Town from 9 a.m. Come, let us celebrate our culture.
Welcome back, and thank you so much for keeping it GTN TV, the home of gifts and talents. And here on Medicamp today, we are talking about asthma. We've discussed quite a lot, but right now I want us to talk about when we were mentioning about the types of asthma. You mentioned that exercise can induce asthma. So how does that happen? And then again, should people with asthma exercise? And if so, how can they do that without the exercise being a trigger for a reaction?
Yes. So exercise, as I said, itself is a trigger. And when you talk to the trigger, we said it's anything that is environmental that makes your body to respond in a way that is in excess or hyper-responsive way. So remember when I talked about the physiology or how asthma comes about, I mentioned of an imbalance of some cytokines called the Th2 cytokines. So you have Th2 cytokines which actually causes an imbalance and leads towards a way of our body immunity, which you call humoral-mediated immunity. So in the humoral-mediated immunity is whereby you trigger a reaction through your immunoglobulins, and those immunoglobulins, we say they are called IgE, IgE type or immunoglobulin type E. So immunoglobulin type E actually are the ones that actually causes a reaction or hypersensitivity once they are triggered and once they mark this allergen, which is an exercise. So yes, exercise can cause an asthma attack, and with this response you have whatever we talked about. We see the airway, the chest tightness, and also the wheezing and all this. So it's how the body responds to anything that triggers from the environment to cause a reaction from the body. Yes, people with asthma, they can exercise. But we recommend that when they're exercising, we usually have a medication that usually they can always take before they even start the exercise. We have those short acting that I mentioned, like the SABA. You can administer them maybe 15 minutes before they exercise as a way of preventing or preparing the body towards counter-checking this response that the body usually gets or answers to. If they are not not well controlled with that SABA, we can also add another controller agents. So remember I talked about a ladder-wise or a step-up control mechanism. So we can add one agent to another, because you don't want also to restrict exercise. Remember, is important, and you don't want to restrict them from exercising. Yes, they can exercise.
Thank you so much for that. And given that asthma is going to affect your breathing or your airwaves, now for pregnant people, is it going to make it severe? Can pregnancy make asthma severe?
Yes. So asthma affects about 4 to 8% or 18% of pregnancies. And those who have mild and moderate or well-controlled asthma, they have a good maternal and also good perinatal outcomes. If they are not well controlled, like those who have severe or not well controlled symptoms, these symptoms affect both the baby or the fetus and also the mother. Some of the outcomes for the fetus is because remember, when you have asthma, you have a reduced supply of oxygen into your system, and this means that also the amount of oxygen that reaches the baby or the fetus is also reduced. And some of the effects with the reduction of this oxygen is you have a restricted growth of the baby. So you have a premature baby. You can also have some congenital malformations, like for example cleft lip and palate. You also have babies who have low birth weight with other complications. To the mother, they say that asthma actually, if it's not well controlled, can lead to some of the gestational diseases or gestational conditions that the mother can have. One of them is hypertension. So it can lead to hypertension. It can also lead to gestational diabetic. You can also, these also, if it is also poorly controlled, can also lead to premature rupture of membrane. These were during birth of the baby. So you have membranes that prematurely ruptures for you to expel the baby. Also, is also a risk to, if it's not well controlled, it's also a risk to do what? To undergo what we call cesarean section. Some undergo cesarean section due to hypoxia state of the baby. Yeah.
And you've talked about some of the complications that could happen to the fetus, but is it possible for your mother to pass asthma through to the baby?
Yes. What I usually say is, let me put it like this way. If a child is born in a family that has a genetic line or a genetic predisposition of asthma, the higher chances of him or her getting asthma. And also, if a pregnant woman smokes during pregnancy, there's a higher chances of passing or baby getting what? Asthma. Yes.
And are the same signs and symptoms of asthma that we talked about, are they the same ones that will manifest in babies, like small babies?
Yes, definitely. Remember, as I said, remember babies have non-specific symptoms, but as long as it's affecting the airway, you can tell that this baby has airway. You'll have fast breathing, you'll have chest wall drawings, and also you'll also have wheezing and also grunting in a baby. So you can always tell that this baby, is in an attack. Yes,
Thank you
reduced
so
level
much.
of activity. Yeah.
Thank you so much for that. And now you're going to be talking about how to prevent asthma, and I want to believe that that will have a lot to do with the triggers that you mentioned. Of course, you mentioned some of them, but how do we prevent asthma?
Yes, so asthma is prevented, one, by identifying your triggers. And we have different types of the triggers or allergens. We can classify them into different. We have what we call the communal ones. So these communal ones are, for example, the dusts, the mites, or some even allergic to cockroaches, by the way. Yes. The other allergen types is an industrial. So this one talks about maybe the gases that are emitted. Some are reacting to carbonic gases, to nitric gases, others to sulfur gases. We can also have an occupational. Remember, I talked about the occupational type of asthma, and that's why we mentioned about anything that maybe, in fact, they say that if you have less of these symptoms when you are off work, then it means there's a work that you do that affects you that makes you to get these severe symptoms. Some are reacting, as I said, some react to even latex, other reacts to dust, maybe from the activity that they do in offices. We also have another type of allergens that we call pharmacological. By this, some react even to antibiotics, like ceftriaxone. Some are reacting to this medication. We also have another type of allergens. They call them alimentary allergens. For example, some react even to eating egg. Others react to milk. Others to even meat. We can also, those are under allergens. We can also have other types of allergens like air pollutants, smoking, be it secondary or primary smoking. Others actually have an emotional stress also leads to asthma. So the key prevention is first to identify your trigger and know which type of where do you lie with your trigger for you to develop his asthma. The other thing is, as I said, you remember we need to prevent or to decrease the symptoms and also the exacerbation or the chronicity of these conditions by controlling using what? Using medication. The first one is environmental control, which means you identify your trigger and you avoid it. The second one by use of pharmacological agents, which I talked about, and I said that we have them. We assess depending on your category or your severity. That's what guides us on the basis of what pharmacological agents that we will administer on you. Yes.
And asthmatic people, mostly they will use the inhalers. Now with that inhaler, is that person okay to go, or do they need to visit the clinic from time to time?
It's always good actually because once you visit the clinic, we are able to gauge and know how the severe or how we can be able to categorize you again. Remember I said it's individualized. So the way another person reacts to this asthma is not the same way that I or another one will react to it. So it helps once to gauge also how you're using these inhalers, because some of them actually you can have these inhalers but you don't know how to administer them. So it's always good to actually come for clinics once in a while for us to actually know if you have developed a complication or your symptoms have exacerbated, or you have a good control or a poor control of your asthma. Don't wait until when you have an attack or when you have a complication for you to come to the hospital. So I'll advise those who have asthma first, you need to do your environmental control by preventing what triggers you. And second one, adhere to your appointments with the doctor. Yes.
Yes, thank you so much for that. And that is it about asthma. I want to give you a moment. If you want to hammer on something, you want to tell them to avoid their triggers more, or it's something else that you'd like to mention as we conclude.
Yes, thank you. Remember we said that asthma is one, it's preventable in that you can prevent it by you using your environmental control measures. Two, you don't need to worry when you have asthma. We are trained actually on how to control and how to help you grow and also develop and also prevent mortality and morbidity by good control of asthma. And asthma is both genetic and environmental influence. So if you're able to control your environmental influences, actually be able to control, you have a good control of your asthma.
Thank you so much. That's why you're going to be wrapping it up. You have a parting shot? Someone you want to say hi to?
Yes, I want to say hi to, I want to pass my gratitude to the Odaya Hospital by nurturing me this much. Second, I also want to say hi to the nursing director there, Madam Carol. I'm honored to actually work with her. And I also want to thank those who have actually, the GNTV, for giving me this opportunity to actually educate our people on some of the health measures that we need to undertake for us to have a rich and a productive. Yes. Thank you so much. You're so honored to have you here. And also I'll say hi to Carol. She's those Medicamp champions that are always behind the scenes. And yeah, we are happy and we celebrate you here. So that's why we're going to be ending it today. I want to urge you to take care of your health, because like we say, your health is your wealth. Wealth wouldn't matter if you're not well. So let us all do what we can to take care of our health. Let us embrace our health facilities and ensure that we are a healthy nation. My name is Mombi Mavuti. See you on our next episode this coming Tuesday. Same time, same place here at GTN TV, the home of gifts and talents.
Unajua jinsi ya kupata kazi majuu? The Mount Kenya East Job Fair provides you with an opportunity to learn how to access jobs in the diaspora and connect with recruiters. The event is led by the Principal Secretary TVET, Esther Moria, the Chief of the